Amos. Thank you so much for joining us here at LSI Europe.
Thank you.
Tell me a little bit about CardiaCare.
Right, so CardiaCare is wearable therapeutic. So basically, this is a device that I have right here on my arm. It's a device that actually delivers nerve stimulation to the wrist, and it targets the vagus nerve, which is here on the neck. And basically what we're doing is we're reducing overdrive of the nervous system that contributes to the development of AF and also for the progression of AF. So it's unique, the fact that it's a wearable and it actually treats people. It's not just another monitor.
So as a wearable therapeutic, what are the diagnostic capabilities like of the device?
Right, so basically it is a closed loop device. We have a single lead ECG where we actually track the arrhythmia, and we have a continuous heart rate sensor. So the idea is that we can track or identify changes in heart rate, validate them with an ECG, and treat them in order to prevent the upcoming event.
Tell me a bit about the unmet need in treating atrial fibrillation today.
Yeah, AF is the most common cardiac arrhythmia or sustained cardiac arrhythmia. It affects around 30 million people worldwide. In the US, expected to be about 20 million by 2015. And in fact, 1 in every 4 people over the age of 40 in the future will get AF. So there's a huge unmet need also because current therapies are lacking complete efficacy, I want to say. So it's a big problem. It's defined as a cardiovascular epidemic.
Tell me a bit about the current standard of care for atrial fibrillation and how you guys compare.
Sure. So current standard of care involves either drug therapy, which is 2 types of medications. It's the antiarrhythmic drugs, which have a lot of side effects and normally stop working after a while, so you need to increase dosages and change dosages. And there's the blood thinners, which prevent the risk of stroke. It's important to say that AF basically, as a condition when you have it, is not a life-threatening condition at that moment. However, it increases the risk of stroke due to blood clots and heart failure and a heart attack. So current standard of care, 1 is medication. Second is called cardioversion, which is basically a procedure where you actually zap the heart with a high voltage electricity to bring the heart back to normal rhythm. Unfortunately, that doesn't last. I mean, the recurrence rates are very high, almost 30% within a month, 80% within a year. And the recent technology and the biggest advancements are the ablation procedures, where they actually go in with a catheter to try to either burn or freeze the area suspected of creating the arrhythmia. Success rates are high in the first year, almost 80 to 90%, but as AF as a progressive disorder, the long-term success rates are low, so almost 50% failure rates at 5 years with ablation.
So you mentioned about 30 million people will have AF soon?
30 million people have AF today worldwide.
Okay.
In the US, it's going to reach these numbers in 10 to 15 years.
What does the market opportunity look like then for a device like yours?
Today, it's a $7.4 billion market, and it's increasing. Unfortunately, the age of getting AF is reducing all the time. It used to be an elderly population disorder, but we're seeing young people today getting AF for a variety of different reasons. By the way, the COVID has actually increased the incidence of AF because the immune response triggers an autonomic nervous system response, which triggers AF. So we're seeing an increase in AF. A lot of cardiovascular conditions are with COVID, but AF quite a lot too.
That's really interesting. So how early in the sort of care management process for an atrial fibrillation patient would you be able to receive this technology?
Right. So we're targeting two populations. The first population is the early, it's called paroxysmal AF population. So as AF is a progressive disorder, it starts with these bouts or these attacks that you have, which are called paroxysmal AF. We're targeting the early population, this population where you have these patients that have recently been diagnosed, let's say over in the past year. And the idea is that if we treat them early, we are able to prevent the progression of the disease from these stages, which are defined as paroxysmal initially, persistent, and then chronic AF. So we're targeting the early population. That's around 1 million people, new people each year in the U.S. Another population is the patients that undergo an ablation procedure. Part of the failure of the ablation has to do with the fact there are these, they're called ectopic, or these areas in the heart which create the arrhythmias. And they create these precursors of arrhythmia which trigger the AF. Now, what we're doing, part of what we're doing is we're actually obliterating these PACs, they're called, these premature beats. So there's also a lot of interest from the industry to show if we can actually help as adjuvant therapy to ablation, right after an ablation, to use our device in order to increase success rates with ablation. And keep in mind, this is also a monitor, so looking at these patients right after ablation to see what's going on with them. So these are the two major populations.
That's really interesting. What does the stimulation actually feel like when you receive it?
Yeah, it's not unpleasant at all. It's like a mild tingling, which you feel around here, going up towards the wrist a little bit and towards the palm. Basically, once you target, once you feel that you've basically targeted the nerve, we're measuring a bunch of parameters, electrical parameters, to make sure that we're on the right target and the placement of the device is correct. But it's like kind of like a mild tingling electrical sensation.
And is the response to the administration of stimuli instantaneous? Is it immediately correcting the irregular heartbeat?
So our sessions are not very long. They go from 25 to 45 minutes. When we connected patients to monitor, to heart rate monitors, hospital monitors, in one of the studies, you can see that within 5 to 7 minutes, you're seeing these PACs, or these ectopic sites, beginning to quiet down. So it's fast.
That is incredible.
Right.
What stage are you guys at right now with your technology?
Right. So when clinical stage, we successfully finished our first in human clinical trial when we had atrial fibrillation patients that were actually received our therapy from the ER. So we recruited patients from the ER, one of the major hospitals in Israel, Sheba Medical Center. Patients that arrived to the ER with AFib were recruited to the study. They got our device for 8 weeks of therapy and monitoring, and that was the first in human. Next step is our longer study, bigger study, so 26 weeks of follow-up, so almost 6 months, because this is what the FDA is looking for.
So you're working with the FDA. Does that mean you're going to the U.S. market first?
Yeah, we're targeting the U.S. market first. We're going under what's called the de novo 510K path, where we actually will need a pivotal study is going to be in the U.S., around 200 patients, and clinical phase.
What does the long-term outlook look like for CardiaCare? Is it acquisition? Are you going to adapt the technology for other indications?
Well, we hear that the most probable scenario is an acquisition. It may. I would say that since we're doing vagal nerve stimulation, we have the potential to use this for additional indications. So I think we'll need to consider as the offer comes.
Is there anything in the pipeline?
In terms of another indication?
Yeah.
There is. It's more consumer though. It's actually sports recovery.
Okay.
Yeah.
Could you talk a little bit about it?
I can a little bit. So what happens often, there's a lot of these apps now on a lot of the watches actually that tell you if you've recovered from your sports, or if you're well recovered or not. And some of that, a major aspect of that has to do with basically the autonomic state of the nervous system. What we're able to do is recorrect or correct it much, much faster. So if you're entered into sports in a suboptimal condition and you're recovering very slow because something's kind of like stuck in overdrive, we can bring it right back down. But that said, I mean, that's our, it's
fascinating.
It's great. It's in the future. Again, coming back to AF, it's a huge problem. We love it. We know we can treat there. We know we get excellent results there. So we're going to do AF first right
Well,
away.
I love companies that have sort of a long-term vision of the future, not just planning for the exit, but planning on where you could take the technology next.
Yeah, yeah. Even in the cardiovascular space, there's other indications that actually can benefit from reducing this oversympathetic drive, heart failure, post-MI recovery, and of course, high blood pressure all suffer, or all the excess sympathetic drive contributes to these conditions as well. So there's a lot of possibilities, but
Yeah.
you got to remain focused though.
Yeah, absolutely. Well, there's a lot of opportunity in all of those potential indications. They're massive problems that society is dealing with. So it'll be interesting to follow along how your company is developing. Focusing more on the conference, what brings you to LSI Europe?
Right. So LSI is, first I want to say it's one of the best investor conferences I've been to. And we're part of the MedTech Innovator cohort. So we were actually connected to LSI through the MNTI 220 cohort. As a company, we're always fundraising. So it was a good opportunity to meet a lot of investors here, high quality investors, I want to say. So networking with that respect. Also met with some providers regarding our clinical program. So finding it great.
Why don't you tell me a little bit about the evolution of wearables, where they're at today, and where you see them going?
Well, that's a great question. Thanks for asking that. So we've always said that wearables have this or a staginal approach. They started as consumer devices. They are moving to medical grade monitoring devices like the Apple Watch's ECG and the Fitbit and the Samsung ECG. But we always believe that the next stage of this evolution is going to be therapeutics. So if you ask me what you're going to see in the next 10 years, there's a lot of these devices that actually treat patients. Okay. Now, this is old news. We have insulin pumps and we have cardiac pacemakers, but the external non-invasive stuff is coming out.
That's exciting.
Yeah.
Well, Amos, thank you so much for
Thank you so
stopping by
much.
for this interview. It was great
Excellent.
talking to you.
Thank you.